I'm a consultant clinical editor for Lippincott, Williams & Wilkins. I was a critical care RN for 7 years. During that time, took about 3 years for me to go back to school to get my master's degree in women's health. And then after I graduated, I actually just saw an ad in a local nursing journal for a clinical editor. I didn't really know what that was, but I investigated a little further and was interested in giving it a whirl. NursingCenter.com is a website that is a centralized location for all of Lippincott's nursing products. So we have all 50+ journals on our site, and students and new nurses have access to those journals. A lot of the content is free, but we also organize the content, which makes it easier to find what you're looking for. So if a new nurse is learning about asthma, or a student is studying heart failure, they can come and find all the information from all of our resources. Before deciding to become a nurse, I think you need to ask yourself where you see yourself in the future, what you want to be doing in 5 or 10 years. Why are you even interested in nursing? What do you think nursing can do for you? What do you think you can do as a nurse? What are your goals? And also, I would say evaluate how nursing will fit in with other goals you have. When you do consider a career in nursing, to have an idea of what kind of practice you want to do, what patients you want to see. That's not to say it won't change, because in my experience, I always thought I would do pediatrics. I really wanted to be a nurse. I really wanted to do pediatrics. And yet, when I started my pediatrics clinical rotation, I soon realized it was not for me at all. And then I went critical care, women's health, and publishing. I never foresaw that path. I think it's important to find a program that's a good fit for you. Most importantly would be strong clinical sites and strong faculty, because you're going to spend a lot of time in clinical, and you want to be prepared for the real world of nursing. So you want to get the experience under your belt and actually do procedures, spend a lot of time with patients, work on your communication skills. So I think a strong clinical site, and you want, of course, great teachers to help you along the way. I think that the more education you have, the more marketable you are. I think that advanced practice nurses are going to be playing an even bigger role in primary care, especially as healthcare reform unfolds. Some students and new nurses are having a hard time finding jobs right now, but there's a big proportion of nurses are nearing retirement, so I don't think that's going to be the case for very long. And also, there's so much you can do with nursing. I feel like my job is a prime example of that. If you want to go into research or education, publishing, like who knew? I think there are a lot of opportunities. I think that the challenges out there are reality shock. When you start out as a new nurse, it's good to prepare for it, but it exists. And so does horizontal violence. There's been a lot written about that lately, and many of us have experienced it, but you need to be prepared. It's there. And I think there's a lot to be said for being a team player and offering help to other nurses, and to kind of get if you offer help to other people, if you smile, if you're a team player, that will encourage others to do the same. I think that nursing is such an all-encompassing profession that any past experience that you had will add to your value as a nurse. At the same time, I think you need to be open to receiving input from other people, and just that mutual sharing of experience and information is very important. the technology available now is amazing. Things that were cutting edge 10 years ago are now the norm. And, new developments have taken their place. Also, leadership, the number of nurses in leadership positions, in research, who are really making a difference and bringing forward evidence-based practice is amazing. Also, the quest for magnet designation by hospitals has made a big impact in nursing. I'm really optimistic about nursing's future. I think that the changes of healthcare reform are going to open up a lot of doors, especially for advanced practice nurses. In the IOM's Future of Nursing report, they talk about changes to education requirements, and I think it's wonderful, and I think that we have the potential to improve our professional image. I do worry about, or I'm sure many of us are worried about the cost implications financially and personally about going back to school and getting more degrees. I would say if you're thinking about a career in nursing, go for it. Something sparks that interest in you, so I think it's worth pursuing. Get your family and friends on board to support you on your journey. Talk to other nurses and seek out learning experiences. If you're a new nurse, I would say keep your chin up and be a patient advocate. Advocate for yourself and turn to your colleagues for support when you need it, because chances are if you've had a bad day or a rough experience, that many of us have been through the same thing. So lean on each other, and good luck.